So the drug that I chose for the second video is clozapine, also known as Clozaril. Please don't confuse this with clonazepam or clonidine or chlorpromazine, which is Thorazine, which is what I talked about in the last video. It's not the same. So Clozaril is an atypical antipsychotic medication used in the treatment of schizophrenia and is also sometimes used off-label for the treatment of bipolar disorder and BPD, or also known as borderline personality disorder. The first of the atypical antipsychotics to be developed, it was first introduced in Europe in 1971, but was voluntarily withdrawn by the manufacturer in 1975 after it was shown to cause a granulocytosis, a condition involving a dangerous decrease in the number of white blood cells that led to the death in some of its patients. In 1989, after studies demonstrated that it was effective in treating treatment-resistant schizophrenia, the U.S. Food and Drug Administration, or FDA, approved the use of Clozaril solely for the use requiring regular white blood cell and absolute neutrophil counts. So, kind of to summarize that, in real time, I have a client who's currently on Clozaril, and every 4 weeks he has to go get a blood draw to ensure that his white blood cell count isn't too high. Because if it's too high, then that encounters that he's getting too much Clozaril, and that's not good. So, Clozaril is usually used only in patients that have not responded to other antipsychotic treatments due to its danger of causing the granulocytosis, as well as the cost of having to have blood tests continually during treatment. It is, however, one of the most effective antipsychotic treatment choices. Patients are monitored weekly for the first 6 months, and if there are no low counts, the patient can be monitored every 2 weeks for the next 6 months. Afterwards, the patient may qualify for every 4 weeks monitoring. So a lot of people don't like to be put on Clozaril because once a week for 6 months, you have to go get your blood drawn, and most people don't like their blood drawn, especially those that have the paranoid schizophrenic. They think they're taking their blood for other reasons, so therefore they're not really up to going to get their blood draw. I've seen this happen quite a bit. We've started clients on Clozaril to get their monitoring. They've refused, so therefore we have to take them off. So Clozaril has numerous severe side effects, including, as mentioned a bunch of times, a granulocytosis and seizures, and has been associated with myocarditis and diabetes. Even though those relationships haven't been confirmed, there's still some possible side effects. It can also lead to some less serious side effects, such as hypersalivation and weight gain. So you can have extra production of your saliva, and you gain weight, which I've seen in the case of one of my clients. It is one of the least probabilities of causing extrapyramidal side effects. It can really have a problem with, not a problem, it really does help with the paranoia I've noticed in my clients. So we do take that as a benefit. Usually if they're on Clozaril, they're kind of on less antipsychotics due to the severity of how strong Clozaril is. So as mentioned before, Clozaril is an atypical antipsychotic drug primarily prescribed to the patients who are unresponsive or intolerant of conventional and other atypical neuroleptics. It has been shown to be more effective in reducing symptoms of schizophrenia than older typical antipsychotics, with more pronounced effects in those who have responded poorly to other meds. The relapse rate is lower and patient acceptability is better. There's some evidence Clozaril may reduce propensity for substance abuse in schizophrenic patients. There's been one case reported of successful use of Clozaril in isolated increase in creatine, which is the absence of neuroleptic malignant syndrome in a patient with schizophrenia where other atypical antipsychotics were not successful. So I have a client who had schizophrenia. He tried every It feels like, anyway, every medication out there to help him. He didn't respond well to those. They were just getting ready to put him on Clozaril when he had a major break. Therefore, he was sent to a lockdown facility who was able to inject medications as well as restrain. In my facility I work in, that's not allowed. So unfortunately, I'm not sure if he ever did get put on Clozaril or not. He's a great kid, 24 years old. So it's kind of unfortunate. So Clozaril may cause side effects. Some are serious and potentially fatal. Common side effects include extreme constipation, bedwetting, nighttime drooling, muscle stiffness, sedation, tremors, hyperglycemia, and weight gain. The risk of developing these any extrapyramidal symptoms, such as tardive dyskinesia, is below that of a typical antipsychotic. This may be due to the Clozaril's anticholinergic effects. So it kind of, as mentioned, it helps with, or it can cause a granulocytosis. It does carry a black box warning for the drug-induced a granulocytosis. Without monitoring, that can occur in about 1% of patients who take Clozaril during the first few months of treatment. The risk of developing is the highest about 3 months into treatment, then decreases substantially thereafter. Cardiac toxicity, so myocarditis is sometimes fatal. Is sometimes a fatal side effect of Clozaril, which usually develops within the first months of commencement. Obviously, that's not something we want. Hypersalivation is it's in the M1, M2, M3, and M5 receptors. It's an antagonist to those. It affects your CNS, or your central nervous system. You can have urinary incontinence. Withdrawal effects. Abrupt withdrawal may lead to some pretty bad side effects. Severe movement disorders, as well as severe psychotic decompensation. I have a client who just recently was taken off the PSRB and therefore left our facility, and he has moved to Portland and completely quit taking his Clozaril, and we just got word about 4 days ago that he is not doing well at all. So anyway, that is Clozaril in a nutshell. There's a lot to know about this medication. Again, I've seen the positives to it and I have seen the negatives, but I definitely believe that the positives outweigh the negatives. So, hope you enjoyed Clozaril.